This was going back to neutral would be extension. What about this? Hyperextension. What about this one? Abduction. Back to neutral is adduction in this case. And then you've got internal and external rotation, and then technically this is circumduction. That should be about 8 of them. That's really enough.
Wrist and hand is next.
Yeah, so wrist. Technically, wrist does not have pronation in it, but it does have flexion, it does have extension. Technically, it does have hyperextension too. And then we have this ulnar and radial flexion, or you could also call ulnar and radial deviation.
I thought suplexion. No.
So pronation, supination is elbow only.
Oh.
Elbow's flexion, extension, pronation, supination. Well, ulnar is just toward the ulna, right?
Okay, and then
Radial's toward
okay.
the radius, right, for your flexion.
Scapula is next.
And then scapula, we've got protract, which is so hard to do, right? But it's roll your shoulder, round your shoulder, protraction, retraction. What's this? Elevation, depression,
Upward.
and upward. You really can just do upward and downward rotation.
Okay, I would have thought this was upward.
Yeah, this is elevation, this is depression.
Elbow.
Yeah, so I did, I'll do it again real quick. Flexion, extension, pronation, supination, right?
Head and trunk.
Head and trunk, really they're the same, right? Head and trunk's the same, so I'll just do the head. What's this one?
Flexion.
Flexion, what's this?
Extension.
This?
Hyperextension.
What about this?
Levitation.
Yes.
Right.
Yes. What about?
Lateral.
Lateral.
Flexion.
Yeah, left lateral flexion, right lateral flexion. And you could do a circumduction if you wanted to there too. That's not as important. But
You got hip next.
yeah, so hip same as shoulder. Same as shoulder. So if you know the shoulder, you know the hip, right? Flexion. What's this?
Extension.
Extension and then hyperextension, abduction, adduction, and then basically internal, external rotation. And technically you can do a circumduction. So it's exactly the same as the shoulders.
Knee.
They're both ball and socket joints, so they do the exact same movements.
Knee.
Right, so knee's pretty easy, right? What's knee? It's just flexion, extension. That's it, right? Flexion, extension.
Foot and ankle.
Right, so foot and ankle is 4 movements. You got dorsiflexion, plantar flexion, then we've got inversion, eversion.
Eversion is facing inward.
No, eversion is facing inward.
Eversion is your sole faces
The
out.
outside.
Inversion, your sole faces in.
Okay.
Inversion is the way you sprain your ankle. Right, when you sprain your ankle, you sprain it
It's
inversion.
inside, right?
So you roll your ankle out.